So our next speaker is Dr. Debasish. I request Dr. Satanshu Mathur to introduce him.
Dr. Debasish, we all know, is the chairman of Disha group of hospitals. We have seen Disha just behind this beautiful convention center, and he has more than 11 hospitals in the Calcutta itself. So he has been motivating all of us to know how to grow your hospitals and start the change. We can listen from him.
Good morning, everybody. So it's been quite a big topic, financial clarity, insight, navigating growth in ophthalmic practice, and there's a lot of things to go. Essentially, India is a very fascinating subcontinent. You know, we have the entire Singapore with its population and its GDP, and entire Poland, and entire Mexico, and entire Philippines, Pakistan, and also the sub-Saharan Africa in this subcontinent of ours, which is called India. And so it is for us where we target, we can't do it all. So where we target our work, where we direct our efforts, and what would give the most optimal results, because resources definitely in an ascending, aspiring country is limited. As you go through the industry consumption of intraocular lenses, which is a very good stat, you would also agree to this Singapore sub-Saharan African concept, where 50% of the lenses used are either PMMA or hydrophilic lenses out of these 65 lakh cataracts that we do. So essentially, it depends where and which bracket would you work with. And, you know, this again is complicated by the inequity that exists. So again, it depends. Even in between a state, the capital of the state may be quite affluent, whereas a district may be quite not so affording. So essentially, it is a question of why we want to do what we want to do. And there must be enough clarity and constant consistency in this answer to this why. So if you focus on welfare, definitely we can understand that a country which is ascending and is aspiring with limited resources cannot afford welfare for every person. But it is better probably to bank on aspirations, because it is an ascending democracy. And now, for the next 20 years, we all hear, you know, it's our decade, our next 20 years, the demography is so good, be a 5, 10, $20 trillion economy. So definitely, I think aspirations and banking on aspirations, which means that everybody is going to pay for their treatment, will aspire to more personalized, customized, developed eye care, rather than settle for welfare, health care, and I think yesterday, Dr. Rao, I was talking to him, and he said that we are suffering from one thing, and that is poverty of aspiration, poverty of ambition. So anyway, that was his thoughts. So quality is central. I mean, in any way, we cannot compromise on the quality. So let us be consistent on that. And then if we focus, the biggest tools of scaling would be technology. You can really scale with technology, And then you need people. So the first affiliations could well be your friends, which we did with our case in Disha Eye hospitals. And the next delegation that comes is multitasking and using systems and people to make this entire affiliation as efficient as possible. Like giving a small example of how technology can relieve human effort. We do Optos, we use Optos like indirect ophthalmoscope. Equipment which costs 1 crore rupees, and we charge 300 rupees for an Optos. But we use it in hospitals which see more than 500 patients. So even if you have 10% myopes, you are doing 50 patients with that Optos. We use Optos for every patient undergoing intraocular surgery, and every myope after, every 6 months after their cataract surgery. A lot of cases, and the machines do well, the money is recovered, the retina person is very happy, he doesn't have to bend back to find peripheral lesions, he can just keep on lasering them. And the other thing is, the patients are very convinced when you show them the two printouts and say, this eye is good, but this eye has this lattice with a hole, and you need to be lasered. So eventually what an organization would always require is space for growth, because every individual in that organization needs to grow, and it has to propagate, and ultimately what matters at my age is perpetuity. I don't want to see Disha die in front of my eyes. So here is a blurred slide, and this is a constant picture as I go to other practices and try to see how are they doing financially. So essentially, there's nothing really to hide. I mean, it's our projection, and the next 15 days are added on to this. So this is what it is. Essentially, if you really see that as it goes, 10%, I mean, if you have invested a capex of say 100, a capital expenditure of 100, the best outcome would be that you have to do that 100 in 3 years' time. I explain you why, how. I mean, 20% goes for infrastructure and equipment. 20 rupees of that 100 rupees revenue goes for infrastructure and equipment. 20% goes for the consultant expenditure, 10% for staff, 20% for consumables, and 10% for maintenance, and 20% is a surplus to be invested. But if you do 50, so that surplus 20% is not there, the consumables will come down. You can still manage by cutting costs, by keeping the consultants part-time, staff part-time. So up to 50 of the 100 capex can still be manageable. Now, just to show, I mean, a 1 minute situation. Ronnie, could you help me with this? It won't move, no? Okay, so I was interested of showing you the balance sheets of our all 18 centers. I mean, it's all there and available. So actually, financial transparency is most important, because that helps you to plan budget and all that things, those were written. Now, from there, what do we pick up? Is what is the consistency of advice of our consultants? Are they advising more? Are they advising less? So there is a standard of practice which evolves within the organization. So if somebody is over-advising, his compliance will be low, and that's not good. So, and the dropouts in follow-ups, the second eye conversions, the vision at which he is operating. If he's a very good surgeon, maybe his vision at operation will be very minimal, like he'll be operating at 5% loss. So what's the brand value? How many times are the consultants being asked that I want so-and-so? And the relative comparisons of these factors within the branch and within the branches. So these are important guidelines to take us forward. And this, the economics is so important. See, if you just follow us, our institution from 97 till this date, of course, this is up to 21. I think the next two are also there, but it couldn't be accommodated. See how the expenditure for an elective planned procedure of cataract, we don't force them. I mean, this lens is good, that femto is good. But it's their choice and their affordability, based on their affordability, and it follows the GDP of the state. And consistently about 1.5 times, which actually is, our GDP assessments are also not as good. And, the PPP factors are also there. I think we are running short on time. So usually the perception is low cost is low quality. I mean, how can something cheap be good? But I mean, most of you must have flown in Indigo to Kolkata, so you know the answer. It is about quality, and then rolling it out properly through systems and processes. You can definitely hit low cost, because it is a purpose of the organization to be cost conscious. If you do your work efficiently, if we do our work efficiently, we can improve costs. So if you can improve costs, you can reduce prices. So that is the statement, that the cost is the first step to quality, and quality further improves cost. And fair price, it can do magic, because if I get excellent conference of this quality, say for 1,000 rupees, you say, oh God, I mean, these guys have done miracles. And you keep on coming to Kolkata every other time. So that is how economies of scale build up. And so there are many lean concepts. I'll just run through them, go step by step. And of course, like if you can't afford building a hospital, go for rent. You can share it with the promoter. He can be a part of the business. Equipment can be on hire purchase. Sleeping costs, most important. Appointments can reduce sleeping costs, because you can be sleeping in the afternoon, we're very busy in the morning. But if you plan your day and give appointments, everything is distributed out. Multitasking, encourage the staff to multitask. Say you can take a holiday. If the reception person can work in the operation theater, they can say, oh, she will take care of my job, so I can take a unplanned leave today. And doctors better be on MG, and we give year-end incentives, which is on a per-case basis. We encourage them to brand themselves, because that motivates them to do something more, and we compensate more for their brands. So, at 45s, which is a common time that doctors leave the organization, we target that, he should be earning as a 45-year consultant, good consultant like him, outside, so that he doesn't bother. I mean, I'm quite well here in other ways. I'm doing a good job, earning a good money. So, organizations also become patient-centric. And these are the various ways of infusion of capital. We all totally rely on internal accruals, because one good thing about it is you grow or evolve as much as your balance sheet tells you to do. Because as much as your surplus in following, so much do you invest. But there are loans, and of course, there is a burst of the segment of venture capital, private equity, and all that. But that is monetization of your value. It's risky, and please, if you are looking at it, we must treat it as debt. It is debt and very costly debt. So after 26 years, it's stories. It's stories which go on, and our story is a story of low cost, quality in eye care which continues. This is our multi-speciality which is coming up, and this is a slight diversification, but this is just because doctors, patients, and the staff at this stage want to do with the surplus. Thank you very much.
Thank you very much, Dr. Debasish, for a very insightful talk. Very few talks go to that depth. Before we move on to our next speaker,